Hiya. So, welcome back here. Thank you for watching and thank you for coming back here. Me and my person. We welcome you to our channel and we're delighted to have you watch us. So, we are going to look at one of the skill stations, and that is the urinary catheter, removal of the urinary catheter. Okay. So with the urinary catheter, we are going to go through the marking criteria, and then we shall go into the how to, some specific things you should go to, and then we shall also go through the health education you can give the mother after the urinary catheter removal, of what they should expect. Okay, so let me not waste time on this. Let's go in straight away. So with the marking criteria, number one, explains the procedure to the patient and informs them of the potential post-catheter symptoms such as urgency, frequency, and discomfort, which are often caused by irritation of the urethra by the catheter. Then secondly, you should go on and assemble the equipment required. Do you know the equipment you need for catheter removal? Or do I need to go through them? Okay, let me see if I think I made them down here. Okay, one of the things, the syringe, 10 ml syringe, and then you need the kidney dish, you need saline, you need swabs, you need continent sheets. Okay, so we shall go on. Cleanse hands with alcohol, hand rub, and washes with soap and water, and dries with paper towels following WHO guidelines. We've been through this so many times. This has 8 steps. This is one. It is side by side. When you say sharp, also the other side. This, the back of the palm. Then we go into interlace. Okay, so you interlace this side, interlace this side. Then we go into the interlocked. We interlock this side, interlock this side. Then we go into rubbing of the thumb, this side and this side. Then we go into rubbing the tips. Then we go into rubbing of the wrists. Rinse the hands, and then you air dry for 30 seconds, or you dry your hands with the alcohol, with the hand towels. Okay, then puts on disposable plastic apron and non-sterile gloves. Okay, then confirms volume of water in the balloon is 10 ml and uses the syringe to deflate the balloon in full. Asks the person to breathe in and out as the person exhales, gently but firmly with a continuous traction. Removes the catheter. Continuous traction. Let's say this is the patient. This is the patient. So let's say this is the place of the catheter. So with continuous traction, let's imagine this is it. So let's imagine this is our catheter that we have. So you tell the mother to breathe in and out. So you hold the catheter and traction down. This is traction. Okay, this is after you've deflated. Okay, until it's out, and you place it in the kidney dish. Okay, so then cleans and dries the area of the genitalia and makes Jamira comfortable. Encourages the mother to mobilize and drink 2.5 liters of fluid per day. Disposes of equipment appropriately, including the aprons and gloves. Remember, I told you about the yellow bin, so make sure you have the right bin near you for you to dispose of your things that you've used. Cleanse hands with alcohol hand rub, washes with soap and water, and dries with paper towels, following the WHO guidelines. Verbalization is accepted. Then verbalizes to the person informs the midwife when she has passed urine. So you tell Jamira that please inform me when you pass urine, like the first time she passes urine after the procedure. So the last one is act professionally throughout the procedure in accordance with the NMC 2018, the Code Professional Standards of Practice and Behavior for Nurses, Midwives, and Nursing Associates. Okay. So something else, wait a minute. So also something else we've not talked about is when you're going to start the procedure, you need to use sterile gloves, okay? And also use 4 perineal hygienic swabs. You're going to use 4 swabs and also a sterile vaginal pack. I forgot to mention that. So we're going to go into the how-to, okay? So let's assume again my mother is Jamira. So I'll go on and say, we begin with the basics. Assess the room, assess the room, approach them and assess the room for any slips, trips or falls. Provide privacy. Introduce yourself to the patient. Dash, I'm going to be a midwife today. I'm going to carry out this procedure. Is that okay with you? And then you ask the mother to introduce herself. Check that with the wristband. And then we go on. Hello, Jamila. You had a cesarean section and I've come to remove your catheter. Is that okay with you? Okay, she'll answer yes. And then we shall continue to say, can I confirm your name and date of birth, please? So she'll go on. My date of birth is 12th January 1994. My hospital number is 123456. You go on to ask, do you have any allergies? You have to ask everything about allergies before every procedure, because some mothers are allergic to latex. So that's why you have to confirm so that you know which gloves to use. Okay, it's as simple as that. And then you ask her, are you able to move out of bed? If she's able to, then you tell her, let me go and make preparations and I'll come back to you. Okay, so you put on your apron, wash your hands according to the WHO guidelines, and then as you look around to make sure the environment is safe for you and your client, provide privacy by drawing curtains. And then I'll check my trolley to make sure everything I need is available. And those are the surgical gloves, the vaginal pack, and the syringes needed. Okay, so you tell Jamira, "Well, Jamira, I'll be back, and are you happy for me to do the procedure? It is going to be a bit uncomfortable, and these are the signs you will feel. You may be having urgency of urinating and frequency of micturition. So if you get pain," then I'll tell Jamira, you may be having urgency of urinating and frequency of micturition. So if you get pain while urinating, please inform me. And if you see any blood while urinating, please also inform me. Or if there is any abnormal discharge from the vagina or the perineum. Okay, so you're going to sleep on your back, then flex your legs a little bit. As I'm going to do the procedure, you're going to help me breathe in and out. So it may feel uncomfortable or a little bit of burning sensation or irritation from the catheter side. Okay, so I'll provide privacy and approach Jamira. Look at the urinary catheter and note the amount of urine that is in. I'll go on and look for any residues or blood in the urine. Madam Examiner, I want to confirm my urine is clean. So I'll get my alcohol swabs and rub the pot. But also you have to rub the pot and then get my 10 ml syringe. So I'll confirm with the examiner, Madam Examiner, how many mils to inflate? This is to help you confirm that the 10 mils were inflated in. So to know how many mils you're expecting to remove with your syringe. So they are especially or commonly 10. Okay. So you connect the empty syringe, this empty syringe to the catheter port. So you withdraw the water used to balloon, and then you confirm with the examiner that, Madam Examiner, I can confirm I have 10 mils, and then you go on to discard it. So I'll use the traction method to remove the catheter, as I tell Jamira to breathe in and out. I also look at the catheter to see if there are any signs of infection like blood, unusual discharge. I will discard this into the bin. This is to also that with some, if you have the kidney dish, use that, and before you discard it, then you ask Jamira, is it okay I clean your perineum? If she says yes, so I'll get my vaginal swabs, clean the labia, the vestibule, and dry her very well. And I'll help her put on a clean pad. I'll leave her comfortable and close the curtains for privacy. Jamira, this is in case you pass the first urine, please put it for me in this container and inform me, okay? So, and then I'll also tell her, if you kindly take a lot of drinks to flush the bladder, you also have to do pelvic floor exercises, the Kegels. You specify to her that you have to do the Kegel exercises, and also have good perineal hygiene. This is to avoid infections. And also when you're cleaning yourself, clean front to back to avoid contaminating the perineum. And also have a balanced diet to help in proper healing of your body. If you encounter any problems, please tell us. Then I will go and do my documentation and discard what I have used. I'll put off my gloves, my apron, and discard them in the appropriate bin, and wash my hands according to the WHO protocols. Okay, we all remember the 8 steps of hand washing. So that's what we still follow up. Then what else? Okay. Then we shall go on to, you give the mother the call bell to call you in case after you tell her, after you give her the container and telling her to call you when she passes her first urine, leave her also the call bell. I forgot to say that. Leave her the call bell to call you when she is ready or has passed there, she needs anything to inform you about any changes. Okay, so after you discard your PPE, document. Remember to document after every procedure, and then you give feedback to the examiner and tell them you're done with your procedure. This and this has been done. So yeah, I think that's it about the urinary catheter. I wish I had a catheter here. Well. Thank you for watching. Please, what else do you want us to discuss? Please leave the comments, and I see what to do. We need to finish this. Comment and ask. Bye. Maybe it's gonna wish you bye. Love you. Have a good night.